I'd like to think that I've been one of the more sensible voices on YouTube about COVID and the vaccines, and one thing about me, no one looking at the history of my channel or my podcast would ever mistake me for an anti-vaxxer. I've done everything I can to counter the fear-mongering about vaccines, and with regards to COVID, I've made several videos covering how safe and effective the vaccines are. Of course, there are those people for whom the vaccine either won't work, like if you have a transplanted organ and you're on immunosuppressants, or if you're prone to anaphylaxis, so always consult your doctor. But things have gotten really crazy. I had hoped that one good thing about Biden being elected would be that a lot of this partisan craziness would stop now that they didn't have Trump around to make them completely deranged. But apparently the derangement is here to stay, and the latest is about the vaccines, which the government is wanting to require for everything from having a job to traveling around the country. Fourth and Fifth Amendments be damned. And apparently, being against these forceful measures makes you an anti-vaxxer now. Folks, there was never any good reason for these, nor was there a need. The vaccine reluctance is not there because of crazy people on the internet. It's there because of politicians in the news media who just can't let go of all the control they usurped, and so they have to bleat on about people still wearing masks after being vaccinated. The vaccines aren't perfect. As I've covered, they're basically between 88 and 94% effective depending on the vaccine and the strain of COVID. So if we figure that to be 90%, that means 10% of those vaccinated are still going to get infected, although likely not as badly. And it's going to be more likely among the higher risk population. And yet, they still won't consider targeted protection to be any kind of viable option. Even though that's exactly how SARS-CoV-1 was eradicated without even a vaccine. But it's just ridiculous somehow to think it might help with SARS-CoV-2. That's exactly the kind of thing I think people need to know. Traditionally, we've had groups like the ACLU there to help us out with this, but sadly, now the ACLU has betrayed everything they stand for, gone against civil liberties, and sided with the government and their vaccine mandates. Think about it. If government can force you to inject a substance into your body, what civil liberties can you have left? Glenn Greenwald has a good article on this on his Substack. He quotes the ACLU tweeting, "Far from compromising them, vaccine mandates actually further civil liberties. Vaccine requirements also safeguard those whose work involves regular exposure to the public." And he also quotes from the New York Times article written by two of the ACLU's senior attorneys, "Do vaccine mandates violate civil liberties?" You have to be a lawyer to come up with doublespeak like this. Listen. When it comes to COVID-19, all considerations point in the same direction. In fact, far from compromising civil liberties, vaccine mandates actually further civil liberties. Yeah, like rain furthers being dry. Many claim that vaccines are a justifiable intrusion on autonomy and bodily integrity. That may sound ominous, because we all have the fundamental right to bodily integrity and to make our own healthcare decisions. But these rights are not absolute. Oh boy, what have I been warning about, people? We've talked about this trope before with regards to censorship. Other exceptions exist, so this exception is valid too. Sorry, doesn't work that way. They do not include the right to inflict harm on others. While vaccine mandates are not always permissible, they rarely run afoul of civil liberties when they involve highly infectious and devastating diseases like COVID-19. While limited exceptions are necessary, most people can be required to be vaccinated. Where a vaccine is not medically contraindicated, however, avoiding a deadly threat to the public health typically outweighs personal autonomy and individual freedom. So where I compared this to censorship, Greenwald compares this to privacy. The op-ed sounds like it was written by an NSA official justifying the need for mass surveillance. Yes, fine, your privacy is important, but it is not absolute. Your privacy rights are outweighed by public safety. We are spying on you for your own good. And remember Franklin's maxim, if you give up your liberty to obtain safety, you'll end up with neither liberty nor safety. And the op-ed appropriately ends with this perfect Orwellian flourish. We care deeply about civil liberties and civil rights for all, which is precisely why we support vaccine mandates. So as Greenwald points out, to refute the ACLU post-COVID, we only need to turn to the ACLU pre-COVID. What makes the ACLU's position so remarkable, besides the inherent shock of a civil liberties organization championing state mandates overriding individual choice, is that, very recently, the same group warned of the grave dangers of the very mindset it is now pushing. In 2008, the ACLU published a comprehensive report on pandemics which had one primary purpose: to denounce as dangerous and unnecessary attempts by the state to mandate, coerce, and control in the name of protecting the public from pandemics. And the thing about it is, as we've seen over and over and over again, all such mandates do is make people suspicious of whatever's being mandated. Talk to someone who isn't an actual anti-vaxxer, but who's reluctant to get the vaccine nonetheless, and ask them why. Dollars to donuts, it'll be because they feel the government is shoving the vaccine down their throats. After all, why would the government have to do that if vaccines actually worked? And it makes them suspicious, thinking that this is all about making money for Pfizer, and being suspicious that Operation Warp Speed bypassed a lot of the FDA requirements to get the vaccine out early. When really, that should make people suspicious of the need for these FDA requirements to begin with, but I've talked about that plenty of times before. If anything, it's the FDA that people need to be questioning. The immediate impetus for the ACLU's 2008 report was twofold. One, the 2008 emergence of the avian bird flu pandemic, which produced highly alarmist and ultimately false headlines around the world about millions dying. And two, new pandemic legislation and regulatory frameworks enacted in the wake of 9/11, premised on the view, as the ACLU put it, that every outbreak of disease could be the beginning of some horrific epidemic requiring the suspension of civil liberties. The ACLU issued its 2008 report to warn that the worst possible way to respond to a deadly pandemic was through coercion and mandates. Instead, the group argued, as one would expect from a civil liberties organization, persuasion and voluntary compliance were both more effective and less likely to erode core liberties. As they put it, the lessons from history should be kept in mind whenever we are told by government officials that tough, liberty-limiting actions are needed to protect us from dangerous diseases. Specifically, coercion and brute force are rarely necessary. In fact, they are generally counterproductive. They gratuitously breed public distrust and encourage the people who are most in need of care to evade public health authorities. On the other hand, effective preventative strategies that rely on voluntary participation do work. And I think on some level people know this. Even when they argue for their pet government policy, they recognize it in other areas. What they actually argue for is exactly what I've been doing: educational messages that will result in voluntary compliance of people who can now make a truly informed decision. Government agencies have an essential role to play in helping to prevent and mitigate epidemics. Unfortunately, in recent years, our government's approach to preparing the nation for a possible influenza pandemic has been highly misguided. Too often, policymakers are resorting to law enforcement and national security-oriented measures that not only suppress individual rights unnecessarily, but have proven to be ineffective in stopping the spread of disease and saving lives. This law enforcement national security strategy shifts the focus of preparedness from preventing and mitigating an emergency to punishing people who fail to follow orders and stay healthy. And as they pointed out, over the history of the U.S., with all the pandemics we've experienced, including bubonic plague, smallpox, Spanish flu, typhus, yellow fever, cholera, diphtheria, polio, whooping cough, and many others, whenever the government tried to fix the problem through coercion, it didn't work. Lessons from history. American history contains vivid reminders that grafting the values of law enforcement and national security onto public health is both ineffective and dangerous. Too often, fears aroused by disease and epidemics have justified abuses of state power. Highly discriminatory enforceable vaccination and quarantine measures adopted in response to outbreaks of the plague and smallpox over the past century have consistently accelerated rather than slowed the spread of disease, while fomenting public distrust and, in some cases, riots. And I would remind you of what I pointed out at the very start of the pandemic. This sort of thing was not unknown to our founders. Humans have been putting up with this kind of thing all along. And in the late 1700s, some epidemic or pandemic was blowing through North America every 5 to 10 years. Our founders understood this quite well, and yet they still put the right to peaceably assemble in the First Amendment. And they point out the problem expressed by Franklin's maxim as well. This model assumes that we must trade liberty for security. As a result, Instead of helping individuals and communities through education and provision of health care, today's pandemic prevention focuses on taking aggressive, coercive actions against those who are sick. People, rather than the disease, become the enemy. And oh boy, are we seeing that in spades today. The former incarnation of the ACLU called it precisely, not to mention Ben Franklin. And it's not just that, it's Friedman's maxim as well, that there's nothing more permanent than a temporary government program. The law enforcement approach to public health offers a rationale for the endless suspension of civil liberties, they explained. Using post-9/11 expansions of state power as its framework, the group explained that the global war on terror may go on for a generation, but the war on disease will continue until the end of the human race. There will always be a new disease, always the threat of a new pandemic. If that fear justifies the suspension of liberties and the institution of an emergency state, then freedom and the rule of law will be permanently suspended. And that's exactly the opposite of what the ACLU just published. How do you think COVID compares to smallpox? If the fact that the disease is, in their words, highly transmissible, serious, and lethal justifies these mandates, then it would have to end spades with smallpox. But as the pre-COVID ACLU explained, in contrast, New York City relied on a different approach in 1947, one that viewed the public as the client rather than the enemy of public health. When smallpox reappeared in the city after a long absence, the city educated the public about the problem and instituted a massive voluntary vaccination campaign. Not surprisingly, no coercion was needed. Provided with information about the need for and benefits of vaccination and reassurance that the city was helping rather than attacking them, the citizens of New York turned out en masse for one of the world's largest voluntary vaccination campaigns. The campaign was successful, and the epidemic was quashed before it had a chance to spread broadly in the city or beyond. Now, that report was from 2008 in response to fears about bird flu, but it wasn't the last time the pre-COVID ACLU spoke out on the issue. A separate ACLU report from 2015, issued during the Ebola epidemic, contained a similar message. It warned against politically motivated and scientifically unwarranted quarantines, which the report found violated individuals' rights and hampered efforts to end the outbreak. Hysteria over Ebola came so intense that the ACLU found that people were illegally deprived of their right to due process under the 14th Amendment because the quarantines and movement restrictions were not scientifically justified. It's like we libertarians have been saying all along. It isn't just that these restrictions are extremely unethical, it's that they don't work. Voluntary compliance works much better, and these mandates only place more power in the hands of the state, power that it is never going to want to relinquish. Greenwald posted an update we'll get to in a second, but his original article concluded, how the ACLU fell from these traditional and vital civil liberties positions to urging this week in the New York Times that, far from compromising civil liberties, vaccine mandates actually further civil liberties, is anyone's guess. But what is beyond doubt is that it is a far fall indeed. And most of all, hearing the ACLU invoke the standard rationale of authoritarians, we all have the fundamental right to bodily integrity and to make our own healthcare decisions, but these rights are not absolute, is nothing short of jarring. So in this update, the ACLU even took this position last year with COVID. Read ACLU's 2020 position paper passionately and correctly arguing that vaccine mandates exacerbate racial disparities and harm the civil liberties of all. Winter was referencing this ACLU report from May of 2020 that warned of the serious dangers of immunity passports under which citizens who already got COVID and thus had immunity would enjoy rights not available to others. We at the ACLU have serious concerns about the adoption of any such proposal because of its potential to harm public health, incentivize economically vulnerable people to risk their health by contracting COVID-19, exacerbate racial and economic disparities, and lead to a new health surveillance infrastructure that endangers privacy rights. This division would likely worsen existing racial, disability, and economic disparities in America and lead people struggling to afford basic necessities to deliberately risk their health. While such a scheme is different in degree from vaccine passports, let alone vaccine mandates, which the ACLU is now championing, Its rationale for opposing such a system is fully applicable. There are serious civil liberties and civil rights harms from making workplace decisions on that basis, adding, any immunity passport system endangers privacy rights by creating new surveillance infrastructure to collect health data. It really does make you wonder what happened that made the ACLU do this about-face. Personally, I don't think there's any doubt that if Trump were calling for vaccine mandates and travel restrictions, people like the ACLU and others on the left would be hitting the ceiling, especially considering how hard this would fall on the poor and African American communities. People, nothing good ever came out of a papers, please mandate, especially at a time when the courts seem to be getting more and more deferential to whatever new power the government wants to grab, instead of being the check against expanding government power they were designed to be. So, comments for the comment god, shares for the share throne. Please hit like, subscribe, and the bell, and go to donate.bogosity.tv for lots of ways to support this channel, including becoming a supporter on Patreon or Subscribestar, where you can get all my videos early and ad-free. Until next time, stay strong and be free.